Information Center Livable Communities webinar. Today's webinar is titled Transportation Equity, Issues and Approaches to Reduce Disparities in Access to Pedestrian and Bicycle Facilities and Programs. And we will be speaking with Tab Combs, a postdoctoral researcher at the Institute for the Environment at the University of North Carolina at Chapel Hill, Dana Dickman, a senior planner and programs manager with Alta Planning and Design, and Keith Holt, a bicycling advocate with United Cycling Voices. My name is James Gallagher, and I am the PBIC Communications Manager. I will be facilitating today's webinar. For more information on future webinars or to view the archives from this webinar series and others, please visit www.walkinginfo.org/webinars. You can also stay abreast of PBIC webinars by following us on Facebook at facebook.com/pedbike. In addition to these webinars, PBIC offers 4 different in-person training courses to provide technical assistance to professionals and community members in developing pedestrian safety action plans and improving conditions for walking. These courses can be found at walkinginfo.org/training. Now I'd like to welcome and thank Tab, Dana, and Keith for their presentations today. We will take questions at the end. Tab, please take it from here.
Good afternoon, everybody, and thanks for tuning in. I'm going to start us off by just going over some of the basic issues around this idea of pedestrian and bicycle equity. What some of the major causes of it are, what it looks like, what some of the consequences are, and why I think that PedBike practitioners are uniquely positioned to take action to address some of the disparities in access to pedestrian and bicycle opportunities. I'm going to finish with just briefly going over a couple of recommendations for what we as PedBike practitioners can do. I'm not going to really get too much into that, though, because I think that's kind of what Dana and Keith are going to be talking about. So really, I'm just here to sort of set the stage to get us all thinking on the same page about what PedBike equity is. So to start off with, what is it? It's equity is a term that's used pretty regularly, but it's misunderstood a lot, and it's pretty tricky to define. Within the context of transportation planning in general, and pedestrian and bicycle planning in particular, though, we really should be discussing it in terms of equitable access to destinations, facilities, and opportunities. Equity of access can be discussed and conceptualized in 4 ways. In the first conceptualization, equity is thought of as an equal distribution of opportunities across individuals or households. For example, a transit service might distribute bus stops across a city directly tied to the location of households across that city. The second conceptualization is tied to need, and the goal is equality of distribution of outcomes, not of opportunities. Achieving equality of outcomes really requires concentrating access to opportunities among individuals, households, or neighborhoods with the least ability to access those opportunities on their own. So the short version is concentrating opportunities in areas with the greatest need. This is a conceptualization of equity that we often strive to achieve, and the one we'll probably be referring to the most throughout this webinar. The third and fourth conceptualizations define equity in terms of demand and efficiency. In practice, distribution of pedestrian and bicycle opportunities often follows these versions of equity more than the others. And that's given that individuals with greater needs really can't effectively demand greater access to opportunities, either through market forces or through political forces. Following the need-based conceptualization of equity, inequity with respect to pedestrian and bicycle travel occurs when there are discrepancies in the abilities of individuals to travel safely and productively by foot or bicycle, and when those discrepancies are associated with need. So this distinction separates people that have opted into situations with poor PedBike accessibility from those for whom diminished PedBike accessibility really is an inescapable fact of life, so it's not a choice. And for this latter group, diminished ability to travel via PedBike mode comes from intrinsic sociodemographic factors, extrinsic environmental factors, and often from interactions between sociodemographics and environments. So There's no single characteristic of an individual or a population that causes them to experience disparities in access to pedestrian and bicycle opportunities. However, there are certain sociodemographic characteristics that are associated with such disparities. These characteristics typically include, but really aren't limited to, low income, membership in a racial or ethnic minority, having limited English proficiency, having a physical and or cognitive disability, being very young or very old, and being female. Individuals or populations with one or more of these sociodemographic characteristics aren't automatically disadvantaged, but they're at a greater risk of experiencing disparities in access to ped-bike opportunities and to travel opportunities in general. And that's because they tend to have unique travel needs that are often not considered in the traditional transportation planning process. Environmental correlates of inequity are somewhat related to sociodemographic. Environments that are unsupportive of ped-bike travel lead to increased risk of inequity. And they include inequitable patterns of distribution of high-quality pedestrian and bicycle facilities. Distribution of those facilities is often biased in favor of areas with low sociodemographic risk factors. Inequitable location of high-speed and high-volume roads, which have historically been placed in areas of low property values and therefore in places that are more likely to have low-income residential development. And inequities in land development patterns that tend to place affordable housing really pretty far away from key destinations. Inequities in access to pedestrian and bicycle travel are worsened when people with high sociodemographic risk factors live and work in areas with high environmental risk factors. So I want to show you a hokey little graphic. Bear with me, please, because I found it's actually pretty useful in illustrating both how sociodemographic risk factors and environmental risk factors tend to vary together, and how the greater the risk factor, the greater the size of the risk factor, the stronger the interaction between them. In practice, what this means is that people with high sociodemographic risk factors are less likely to have access to quality pedestrian and bicycle facilities, are often separated from critical destinations by long travel distances, often live in places with poor variety and quality of destinations, and often live in places with poor transit access and dangerous roadway conditions than people with lower risk factors. So let me give you a quick example of what I mean with these interactions. So consider somebody who has to leave work late at night. He's probably a low income or a minority worker, and he has to get home by whatever means are necessary. If transit services have ended for the night and the worker doesn't have access to a car, that probably means traveling home in the dark by foot or by bike. And if adequate ped-bike facilities aren't available, then the worker's got to resort to walking or riding on streets without facilities. Land use patterns and housing markets may have forced the worker into a residential location separated from his job by long distance along high-volume, high-speed roads. So this guy more than likely is forced to travel longer than average distances along dangerous streets that really don't appropriately accommodate his travel needs. So what are some of the consequences of disparities in access to pedestrian and bicycle facilities? Well, they include increased risk of injury, illness, or death, decreased opportunities for physical activity, increased travel expenses, and decreased access to social, educational, and employment opportunities. The risk of crashes with motorized vehicles is increased when pedestrians or cyclists are forced onto substandard or non-existent facilities, which is more often the case with high-risk travelers. Furthermore, high-risk users, particularly minorities and low-income children, have greater odds of a poor outcome when crashes do occur. Also, high-risk populations have fewer opportunities to engage in active travel within their neighborhoods. This is especially critical for low-income populations, who tend to suffer disproportionately from health problems related to inactivity. The links among income, neighborhood design, and inactivity-related health problems is an increasingly popular area of research. I'm not really going to go into the research here, but I want to point out that it's been summarized pretty thoroughly in a recent Active Living by Design report. And you'll be able to get the reference for the report in the notes from this presentation. A number of studies have shown that high-risk households spend a greater percentage of their incomes and a greater amount of time on travel to fulfill basic household needs than low-risk households. A big part of the extra travel cost comes from the increased need to have and maintain a car. Indeed, the idea of forced car ownership is really starting to gain traction in the research, and several recent studies have found a link between forced car ownership and financial hardship. For more information on the relationship between equity and the cost of travel, there's a recent report from the University of Minnesota Center for Transportation Studies that focuses on affordability and transportation. You can find a link to that report in the notes for this presentation. Finally, there's a growing area of research that's finding that individuals with limited travel options, which includes limited access to walking and biking, travel less overall, make fewer trips for shopping and for socializing, have a harder time applying for and keeping employment, and are less likely to access healthy foods, health care, and educational resources. And those same studies are finding that this involuntary decrease in travel is linked to lower quality of life and social capital, poor physical and mental health, lower levels of education, and lower wages and employment levels. So, as pedestrian and bicycle practitioners, why should we be involved in addressing these equity problems? Well, to start with, concerted efforts to improve the ability of high-risk populations to travel safely and productively by pedestrian and bicycle modes is critical, and PedBike planners and practitioners are really positioned pretty uniquely to lead, facilitate, support, and otherwise contribute to these improvements. These concerted efforts are needed for a variety of reasons. The first is that historical development patterns that contribute to disparities in access to PedBike opportunities take substantial effort to overcome. Market forces may eventually drive the creation of more supportive environments, but they're still likely to be more available to affluent, low-risk populations than high-risk ones for a long time to come. Also, market-driven environmental changes happen slowly. In the meantime, high-risk populations are likely to be stuck in settlement patterns that fail to provide adequate access to PedBike opportunities. So planning for more equitable transportation systems and land use patterns from the beginning is essential to reducing disparities in access to pedestrian and bicycle opportunities. Also, traditional transportation planning and decision-making processes tend to entrench rather than overcome access disparities. And there are two reasons for this. The first is that default decision-making traditions in most communities actually promote demand or efficiency-based outcomes instead of need outcomes. And as we mentioned earlier, demand and efficiency-based outcomes really don't align very well and sometimes actually conflict with need. And second, even when practitioners do try to incorporate need into the decision-making process, accurate information on the nature and extent of that need is rarely available. And this lack of information can be attributed in large part to the long-term disenfranchisement of high-risk populations from planning and decision-making processes. The second reason we need more involvement from PedBike practitioners in particular, not just from transportation planners and engineers, is that the federal transportation equity mandates that affect most transportation planning decisions aren't really sufficient when it comes to addressing pedestrian and bicycle inequities. For one thing, compliance with federal equity mandates requires information on who is at risk of experiencing disproportionately high or adverse effects. And in most communities, this information really doesn't exist. Also, the equity mandates only address low-income and readily identifiable minority populations not other groups that also frequently experience diminished access to pedestrian and bicycle opportunities, like children, the elderly, and women. The mandates really only apply to new projects, and so they don't do much to help overcome entrenched or pre-existing discrepancies in access to ped bike opportunities. And they only focus on infrastructure investment and not on other contributors of ped bike inequity, such as land development patterns or lack of access to soft programs like educational campaigns. The mandates only seek to prevent the imposition of new disproportionate impacts, and they don't explicitly seek to reverse entrenched inequities, nor do they place greater emphasis on projects that specifically seek to reduce disparities. And finally, evaluation of compliance with federal mandates often assumes equal access to motor vehicles, even though high-risk households are, A, much less likely to own vehicles, and B, when they do have vehicles, often face greater financial hardship because of the cost of owning those vehicles. Finally, reducing disparities in access to pedestrian and bicycle opportunities benefits whole communities and not just high-risk populations by improving public health and safety, promoting economic development, strengthening public transit services, and possibly, though the evidence is equivocal, by increasing social capital and neighborhood cohesion. And if that's not enough, remember that most community members will, at some point, find themselves in the high-risk category, whether that's because of temporary or permanent disability, loss of income, or imposition of additional travel burdens. So, efforts to improve access to pedestrian and bicycle opportunities for populations that are currently high risk are likely to also benefit those individuals that aren't high risk yet. So just a few quick recommendations, things that pedestrian and bicycle practitioners really should start thinking about doing if they want to be able to access or to address some of these disparities in ped bike opportunities. The first one is to start collecting information in communities about who is experiencing disparities in access to ped bike opportunities and why they're experiencing those disparities. The second one is to start working to incorporate policies to promote more equitable built environments into the planning process. And finally, to try to support educational campaigns and programs either within your own organization or within organizations in your community that increase safe participation in ped bike travel by at-risk populations. So I hope that gives you a little bit of background about where we're headed with this webinar. I'll be happy to take questions when we're done. Thank you.
Great. Now we'll hear from Dana Dickman.
So that was an excellent introduction, Tab. Great intro to what I'm going to be talking about, which is integrating health and equity metrics into planning practice. And I'm going to do an overview of just a couple of specific and current case studies that really talk about how to consider equity and access throughout the process. So before I get into the actual case studies, this is really reiterating a lot of what Tab just said. Health and equity are really key to livable places. I work for Alta Planning and Design, and we are a transportation planning and design firm that focuses on bicycle and pedestrian transportation, but our mission is really creating active communities where bicycling and walking are safe, healthy, fun, and normal daily activities. So developing planning strategies that support health and equitable communities is really critical to fulfilling that vision of walking and cycling as a really viable daily option for all people in all communities. So the other piece, Tab really used the term at risk. I'm going to use vulnerable and underserved. We know from our work, and the research clearly shows that underserved communities really benefit from cycling and walking options. And just for the purposes of this presentation, I want to reiterate when I'm referring to equity, I'm talking about equitable access to safe and comfortable options for active transportation. The third piece, again, really reiterating what Tab said, is that data regarding specific barriers or needs for at-risk and vulnerable populations is often not available, but that doesn't mean we shouldn't start trying to look at health and equity in all of our planning processes. So the case studies, I'm going to share two that highlight ways to use data that is either relatively easy to gather or publicly available. Again, because we don't always have data that's health or equity specific at a spatial scale that's relevant or detailed enough on a project basis. I wanted to talk about a couple of examples with relatively easy to gather data and how you can start to integrate it at the beginning of a planning process. So simple demographic analysis about underserved populations at the outset of the project, at the very beginning, can be used to inform key aspects. Of course, knowing who's there and what their needs are should inform your outreach and stakeholder engagement process, can inform policy and goal development early in the planning process. And then what I'm going to focus on today is using it to look at actual project development and prioritization for implementation. Our first case study is in Siler City, North Carolina. It's a small community in the middle of the state. It's about 8,000 people, relatively rural context. It is about, just for context, about 50 miles from Durham, 100 miles from Charlotte. This community is very diverse, has about 50% Hispanic Latino population, and is low income relative to the county and state. This project was coordinated with their pedestrian master plan. They received funding from the state DOT to do their master planning process. But during that process, they got additional funding. Chatham County Public Health and Person County received community transformation grant funds that allowed them to really expand the scope of their work and really evaluate the health connections and the equity implications to the proposed pedestrian links in the master plan. This equity vision was really carried forward from the very beginning of the plan, and you can see in the vision statement included on this slide, they really looked at where pedestrian connectivity and access is provided to people of all ages, abilities, ethnic, and socioeconomic backgrounds. That vision was really taken forward into an inclusive planning process. This slide shows just a little bit of information about the current kind of demographic indicators of the at-risk populations in Siler City. You can see that there is about 49% or almost 50% Hispanic Latino population, as I said, and they've got significantly more folks living below the poverty line in the city versus Chatham County or the state. They're also, the median income is significantly lower than the county or the state. These maps can also give you an indication. The one in the corner shows the minority population, median household income, and zero-car households. You can see that much of the city has these demographic indicators, but particularly the eastern side and the northeastern corner have a lot of at-risk populations. So this focus on the CTG funding that really allowed this extended focus on health and equity brought into the scope an opportunity to really complete an assessment of access to opportunities for healthy food and active recreation. So they did a spatial analysis, and early on the pedestrian network was developed, and it included information from previous plans and studies, a sidewalk gap analysis, fieldwork, input from the steering committee and public involvement, and also identification of pedestrian trip attractors throughout the city. But on top of that, this analysis of healthy food and recreation built off that technical work. They started with 21 neighborhood areas in the city, and I want to just talk a little bit about these neighborhood areas for a second, because these aren't just political boundaries. The neighborhood areas, their points of origin, are areas where there were concentration of residences, so large multifamily buildings or areas that are concentrated within the neighborhood. So it's really an assessment looking at connections from where people would actually walk, not just, as I said, a centroid from a political boundary. Through that process, they took the 21 neighborhood areas and did an analysis of walking access on the existing and the proposed pedestrian network to healthy food access vendors and opportunities for active recreation. So really looking at how improving the pedestrian environment would improve the residents' access to health supportive services such as healthy food access and active recreation. I want to take a minute to talk a little bit about the detail on how the healthy food vendors were identified. There were 45 total food vendors in Siler City, but only 8 of them were considered to be the healthy food vendors. There was a 2-tier process employed to identify which ones of the existing food vendors could be considered healthy food. There were 2 graduate students that actually went and analyzed the food provided by each one of the vendors. And first they looked at whether or not there were fresh fruits and vegetables available, and then they also looked at whether or not the vendor sold foods that met the USDA MyPlate criteria. And in order to meet the MyPlate criteria, there had to be at least one item from all 5 food groups. For MyPlate, some of the food could be frozen or canned. And so in this assessment, they looked at combining both meeting MyPlate criteria and selling fruits and vegetables. So on the scale there, you can see the number 5, the ones that became the 8 healthy food vendors met both MyPlate criteria and sold greater than 5 types of fruits or vegetables. And I wanted to take a minute to talk about this specifically because of the importance of identifying what healthy food really means. And this project really looked at the ability of a family or a person to go to this vendor and get materials that would allow them to create a balanced, healthy meal. It wasn't just that they sold a banana, but really could this vendor support healthy habits over time. This map shows the existing connections to healthy food in Siler City. You can see on the map the orange is the existing pedestrian network where there's sidewalks, and this analysis was looking at available access from neighborhoods within a walking distance. So the red links shown are a half a mile or less, assuming that that's a typical walking distance. You can see that there's only 2 neighborhood areas in the city that have walking access to a healthy food vendor. This shows both the proposed pedestrian network and trail network, along with some additional analysis of access to healthy foods. The proposed network provides, if those links are prioritized, provides 2 more neighborhoods with access to a healthy food vendor. You can see those areas are highlighted within the blue squares. Now, the glaring thing about this map, of course, is that even with all of these new pedestrian links, there's still only 4 different neighborhood areas that have walking access, half-mile walking access to healthy food vendors in the community, and I'll come back to that a little bit. This is the existing connections to recreation. And again, these are active recreation sites. It's not just an open space. It is a place where people can engage in, either have tennis courts or a playground or places where there would be opportunities for active recreation. You can see there's only one very small red line on this map. Only one of the dense neighborhood areas has a direct walking distance access to an active recreation site in the city. This is the potential connections to recreation that are shown after the proposed pedestrian network is overlaid. And up in the northeast corner, where we have some of our most at-risk or vulnerable populations, there are 2 additional neighborhoods that would have direct pedestrian access to a recreation amenity. However, again, you can see that there is a significant amount of pretty much the whole city that does not have half-mile walking access to an active recreation site. So some of the key things that came out of doing this great additional health analysis, first they integrated kind of that equity perspective throughout, but then with the addition of the health and equity analysis, these new high priority projects to access services for healthy eating and active living are shown. Without that additional analysis, those network links may not have come up as key priorities when you look at infilling sidewalks throughout a whole city. The other thing that doing this type of analysis, and Tab really touched on this as well, is the analysis around walking access really illuminated disparities in the distribution of food and active recreation for the whole city. It wasn't just for the neighborhoods that had at-risk populations, but for the whole city, walking access to these healthy service amenities are really limited, and it's important for ongoing transportation planning to be thinking about that access and whether or not there's some additional work that could be done to provide healthy food vendors throughout the city. So now we're going to move into an entirely different area of the country and a very different geographic and spatial context. We're going to Seattle, Washington, and their bicycle master plan. And I should say before we move on that Siler City just adopted their pedestrian master plan on November 4th. So these are both very current processes that are happening. Seattle is about to take their bicycle master plan to council. So this is all very, very current work, integrating health and equity into bicycle and pedestrian planning. So Seattle has a history of really integrating equity. The City of Seattle's Race and Social Justice Initiative emphasizes equity as a comprehensive goal for all city projects. So this policy directive really helped to shape how equity metrics were used throughout the entire planning process and will ultimately influence the implementation of the project's plans in the Bicycle Master Plan, both on-the-ground projects and programs. Equity is one of only five project goal areas for the master plan process. You can see here that the emphasis was on including equity throughout the entire process. Provide equal bicycling access for all through public engagement, program delivery, and capital investment. Again, it's looking at outreach, it's looking at project development, and then implementation strategies long term. Equity is one of five goals, but it plays a huge role in the overall process of the plan. So I'm going to take you through a little bit of the first part of their equity analysis. They began using equity metrics and information at the very beginning of the process, bringing it in during early analysis of existing conditions. It was really important from the beginning to make sure that any metrics that were used were really replicable and easily updated. If we're getting very detailed data is important, but knowing from a cost effectiveness or we know that as in most communities you're not going to be able to do a lot of really detailed data collection on an annual basis. And because the city really wanted to be able to use the equity analysis and the metrics in prioritization, having or choosing metrics that were replicable and easily updatable was really important. So they chose all metrics that could come from 5-year American Community Survey data. So that's percent of population, the population that are people of color, households below 200% of the census-defined poverty level, zero-car households or households with no automobile for daily use, youth under 18 years of age, and seniors or people over 64 years of age. And I wanted to take a second to key in on that households below 200% of the poverty level. That metric was actually adjusted throughout the planning process, and this can be true in a lot of communities, that if you only key in on those households that are just at the poverty level, you may be missing whole low-income neighborhoods because that metric is too low, and you want to be looking more broadly at low-income neighborhoods in your community. So I'm going to get into a little bit about how the metrics were distributed, just so you can get a sense of how it played into the planning process. Each census tract that had an above average number in each of those metrics was given a point. So in developing a composite look at equity in the city, for example, if a census tract had an above average number of people of color and an above average number of people that were 65 years or older, the census tract would be given a score of 2. So what you're kind of seeing in this ramping in the maps is the differences in those different metrics throughout. So the blue map shows the households with 0 cars available, green shows below 200% of poverty, and then the purple is communities of color. And I want to draw your attention to those census tracts that are shown in the yellow area, only because I want you to see the trends across the metrics when we get to the composite map that shows over layers of vulnerable populations in the city. These two show both the senior population in brown and the youth population in purple. You'll notice that highlighted census tract in the middle there's not a lot of youth and seniors, but it was very much highlighted for 0-car households and people below poverty and people of color. So when we get to the composite map, you can see that it doesn't rank as the top score, but because it has 3 of the indicators, it shows up as having a high overall equity score. So this map, I want to explain a little bit. This is a composite map showing areas where those at-risk populations are combined. So as Tab was saying, any individual doesn't necessarily, that being a person of color or being a person under 16 who cannot drive doesn't necessarily make you at risk. But in assessing kind of the spatial distribution of vulnerable populations in the city, showing a composite of where these at-risk populations are located in the city can really help the planning process. This particular map shows areas with significant underserved populations from all those 5 at-risk areas, along with low bicycle service provision. So in the initial analysis, they looked at where there were bicycle facilities currently in the city and where there were underserved populations. And this map really highlights that there are specific areas in the city that have low bicycle service provision and really high numbers of underserved populations. So again, in doing this in the beginning, knowing this information really helped the project team to understand the direction they needed to go in outreach, additional questions they might need to ask in these neighborhoods, understanding how these places or these neighborhoods would fit into the overall network. Doing this early in the process and understanding the context of equity was really critical to the overall strategy of integrating equity throughout the whole bicycle master plan. So from that early discussion of equity that infused outreach and network identification, we got to project prioritization. Once the initial bicycle master plan network was identified, there is a project prioritization looking at how to take all of these different links in the city forward into implementation. There are 12 metrics for prioritization that are divided into the different 5 goal categories for 100 points total. So each project or network link will be evaluated in that 100-point scale. Within that 100-point scale, there are 2 metrics that support health and equity specifically, or 20 total points. 15 of those points, or 15% of the total score, are equity-specific points. The map that you're looking at on the right shows how those different equity scores translate to network links. Underlaid is the composite equity map. So you can see the areas in red, those are the areas that would have gotten high scores in the prioritization metric. To explain how that works, it's similar to how the composite map was developed, but the breakdown is different in 0 points, 5 points, 10 points, 15 points. So those projects that scored the highest in equity would have had a census tract that falls in the highest 25% of scores in 4 or 5 of the equity indicators. So if it's the highest 25% of people of color and youth, it would have received 15 points. On the contrary, if the census tract was the highest quartile in, I'm sorry, I didn't list 4 there, in just 2, then it would receive 5 points. The point of this is showing that the more we know about where populations are located in the city, the more we can prioritize network links in those areas and connections for bicycling and walking in those particular neighborhoods. These 2 maps show the difference between all the project criteria and the equity criteria. The map on the left includes all 100 points, and so the connectivity and safety criteria were weighted really highly in the overall mix of scores for project prioritization. But you can see between these 2 maps that the 15% allocated towards equity really provides an opportunity for those network links in those underserved areas to come to the front. The maps don't look exactly the same, but you can see those areas in South Seattle and in the northern section still have a number of high priority projects, and the priority links are coming up to the top with all of the metrics included. So to close, I just really want to emphasize that starting early in order to integrate the process throughout each step of the plan is really critical. Get the early demographic data, use ACS data or other publicly available information to get a picture that you can use to inform outreach, policy development, goal development, network development, and then ultimately project prioritization and implementation. And then also that equity analysis may really surface other issues related to health and transportation. Again, in the case of Siler City, that detailed analysis that was provided on the pedestrian plan really highlighted that they're going to have some real barriers to walking to healthy food and active recreation that don't really have that much to do with the pedestrian network itself. And so they may look at an opportunity to provide mobile vending, to provide walkable access to healthy foods. This analysis can help tie bicycling and walking to all sorts of other issues in land use and plan development that can support health over time. Just to end, I want to give a call out to some of the folks that did the analysis on these plans, Ann Eshelman and Lindsay Smart in Alta's Durham office, and then Chad Lynch with the City of Seattle and Kim Boros in our Seattle office did a lot of the demographic analysis and brought equity into these plans. With that, I will turn it over to Keith.
So thank you very much, and wow, that was a great lead-in from both ladies. That's a lot to take in. So my name is Keith Holt, and just to sort of put out some of the confusion about my title, so I'm a bicycle equity advocate. You might see on here where you might see United Cycling Voices, but you also see myself is listed as Southeast Regional Director for Wisconsin Bicycle Federation, which is who I actually get paid for. So what's going to happen today? What's on the radar for today? I'm going to talk about the creation of United Cycling Voices. I'm going to talk about the League of American Bicyclists, their equity initiative, and then lastly, I'm going to talk about the Safe Routes to School National Partnerships, National Active Transportation Diversity Task Force. It's a lot to take in. So to start off, sort of setting the scene as we talk about United Cycling Voices coming about. 2012, there's a lot of talk that was coming about bicycle equity and diversity from a lot of different areas, just sort of randomness and sometimes haphazardly. One main event that happened that sort of put that out there to some of us as a certain word or phrase that really got us some of us actually thinking was when the merger for the League of American Bicyclists, the Alliance for Bicycling Walking, and what is now People for Bikes, but formerly Bikes Belong, when that merger did not happen, one of the three shared goals that they all agreed to was a goal that said that nationwide, the percentage of trips made by bike will increase to 5%, and the diversity of people on bikes will mirror the diversity of America. And a number of us really took that to heart and said, wow, that's a really, really bold statement. There was someone working with the League of American Bicyclists, one of their board members, and myself and some others, I'm going to mention their names soon, kept talking about the idea we need to do something. And one of the things we really came about was that change that we always tried to see. We felt it needed to happen from an organization. We need organizational change. So we really felt that one of those organizations was the League itself. And so one of the things that happened was that board member was going to work through the League, and their board members talk about the idea of equity. But at the same time, we felt that there needed to be sort of an outside organization that was separate from the League or separate from all organizations that really brought in different bicycle advocates, equity advocates from across the nation to sort of talk about these things and then what can we do to help move things along, even if it's underneath the radar. And that group happened to be United Cycling Voices, like you see here, National Alliance of Bicycle Advocates representing communities of color. We have a mission to advocate, educate, engage decision makers to ensure inclusiveness and equity in all aspects of bicycling. Have a vision that exists to act as an influential agent for social change. Envision more people of color represented in all aspects of bicycling and decision making regarding policies in our communities. It took us a while to really come up with that one. Our group was small. As you see here, this was our logo that we used for coming together. It was actually for the first time face-to-face, some of us, was at the 2013 Bike Summit. And you might be saying, well, who are those founders? Who are those people? Well, here they are. Really a diverse group of folks, and we really felt to really working from behind the scenes that, where we can help nudge and kind of help influence things where we can. And like I said, one of the things we really identified, maybe it was also by just happen chance, that the League of American Bicyclists was that first organization to say, hey, do you want to really step up and bring equity into this movement and trying to address that? And the League just said yes, and they're working through it as we speak. Which we'll get into the equity initiative that I talked about in a moment. Where is the United Cycling Voices as we speak right now? Because so many of our members are also part of the Equity Advisory Council, that's part of the league, the next steps for United Cycling Voices is on a little bit of semi-hiatus right now. We're not sure exactly which direction we're going to go, what exactly we're going to do. We're in limited time, and we, split it of resources and capacity since we're all from diverse parts all across the nation. So I wanted to next talk about the League of American Bicyclists and their equity initiative. In January 2003, the League of American Bicyclists decided to kick off this equity initiative. And it was a goal of the league, as all League of American Bicyclists, to make bicycling safe and comfortable for people of all ages in all communities. But they recognize that youth, women, people of color are underrepresented in many bicycle advocacy efforts and local transportation decisions. Equity issues have been a source of discussion in the bicycle movement for years. However, there's been a lack of dedicated staff capacity, direct knowledge, and guidance from local leaders of color in engaging in sustained strategic dialogue about these issues. Currently, there's a few resources to address disparities on the ground and equity as it relates to specifically to bicycle advocacy. The League's initiative looks to break through this bottleneck by working directly with diverse leaders and change the culture and programming of the League itself to transfer cycling advocacy to local and national level. Through the League's initiative, the League seeks to engage leaders from traditional underserved demographics and bridge the current gap between diverse communities and bike advocates. By adding staff capacity and partnering up with equity advocates in a strategic and sustained process, the League will leverage its position as the longest standing and most trusted source of bicycle advocacy resources, develop diversity leadership, and cultivate effective local partnerships to advance equity in the bike movement. So what does all that mean? Well, it means this. It means that the League is trying to bring about more people of color on bikes in the decision-making process, talking about being a part of bicycling. When decisions are made, people of color are there. And so we can see this at one point. More people of color are actually riding bikes more often. What has the League done lately? Well, the League hired Hamzat Sinani as an Equity and Outreach Fellow. Hamzat kicked off the Equity Initiative with an amazing manner when the program was not even completely funded. So proud of him. The League established an Equity Advisory Council of 10 diverse folks from across the country and one youth. We've been meeting since January of this year, at least once a month. We've actually been able to meet twice, once at the League's Bike Summit in March, and then last October when we developed the strategic plan for the Equity Initiative. As of today, I'm so proud to say the League and its board members have adopted equity as one of its top priorities in 2013 and beyond. Some of you might have actually seen the report, The New Majority, Pedaling Toward Equity, an amazing report that came out. And because of that, one of the things that came out because of that report equity on Capitol Hill. Last month, and I hope I'm going to say this Congressman's name correctly, Albino Serenas from New Jersey. He's introducing the bill in Congress addressing equity in bicycling and walking. The Equity Initiative has been funded for the next 2 years through a foundation. And lastly, just this last, I think it was November, Dr. Adonia Lugo is hired as an Equity Initiative Manager. She's going to, I'm looking forward to her doing an amazing job on helping the league's equity efforts. Where's the league going in 2014? Well, the league just kicked off this Bicycle Equity Network listserv. You'll see a link for it at the end of this presentation. And this is just to give folks who are across the nation who are either self-proclaimed bike equity advocates or who desire to be a bike equity advocate, sharing lessons learned, best practices. That's where the United Cycling Voices is going to put out our announcements too. So, and that just kicked off this probably 2 or 3 weeks ago. The league will have to do is doing an equity assessment of its organization itself, from not just the board perspective, but the staff and the programming, how they operate, how they hire, all aspects of it, because they realize that, you know, as to really make the equity effort really lasting and really impactful, realizing the league itself as an organization needs to adapt. And then lastly, there's this developing an equity toolkit. Toolkit will be a kit that will be shared with either a local community that's underserved, local bicycle nonprofit advocacy organization, or possibly local agency, public agency, to help them develop a better equity efforts on their part. You know, again, back to how to making that sort of change that's going to happen through a neighborhood or organization or through an agency. That equity toolkit is still being developed. There's still open to interpretation, so it's pretty exciting times. Oh yes, and I forget. The Equity Advisory Council will be entering into its 2nd term. Next, I wanted to talk about the Voices for Healthy Kids Active Places, which is part of the Safe Routes to School National Partnership. And within that national partnership, which is a network of more than 650 advocacy organizations that is determined to advance safe and equitable walking and bicycling to and from school in daily life, to improve health and well-being of Americans' children, and to foster the creation of livable, sustainable communities. Recently, the Safe Routes to School National Partnership joined the Robert Wood Johnson Foundation, the American Heart Association, and their Voices for Healthy Kids initiative, specifically focusing on active places. Their understanding of emerging value and community being directly involved in how their community is built, how they're engaged, organizing, and mobilizing people to advance policies that support community design, shared use, street-scale policies, and underserved communities and schools. One of the parts that I'm more connected to is the introduction of their National Active Transportation Diversity Task Force, which is under the banner of that street-scale policies arm of this initiative. There is also a National Shared Use Task Force, both of which will be collectives making up of organizations that represent underserved communities that see the linkage between the work and creative active places. And I wanted you to see, because this is the one, I have to say, I am on this task force, and I was really impressed with the work that the Safe Routes to School National Partnership has done to bring such a wide, diverse group of stakeholders to help address the existing policies and just connection to funds, and to really, breaking people out of their own silos to working with not the usual suspected partners. So it was really exciting. The group has only been meeting, I think we're only meeting a couple of months now, but it was a really exciting effort to see where this can possibly go. And like I said, this active transportation diversity task force, like you see, is composed of just a broad array of experts and practitioners from around the country. We're going to engage in this national conversation, support the outreach, and elevate street scale projects on local issues to state and national issues. And there is going to be a launching of their official campaign searching for efforts, initiatives around the country on shared use agreements, community safety, a safe routes to school and complete streets, and other street scale projects. There will continue to be free webinars to share information about how the Safe Routes to School can support winning campaigns at the state and local level that increase shared use agreements and street scale improvements, promoting community coalitions and organizations, everyday citizens that will support resources and technical assistance to help existing coalitions achieve policy success. And one quick thing that's already come about, and I'm really excited about, is as an example of a new tool for advocates, utilizing Safe Routes to School to combat violence. In a lot of underserved communities, especially in urban areas, that whole idea of Safe Routes to School, well, sometimes it is not just because of lack of concrete or trail or just traffic. Sometimes it is about violence. And this new, in fact, again, less than a month, tool was just presented at our recent webinar. I've only glanced at it, but from what I've read so far, it's very exciting, very interesting, has potential for huge success. And that came about because one of the partners on the task force is already doing that and want to share that with others. So where can you find your place in this equity and bicycling movement? Well, I'm going to ask you to be vocal in your support of more bicycling equity movement. If you believe in this, to ask the question to your local community, to your local biker ped organization, supporting anyone and everyone, because there are voices out there who actually don't think that this is an important issue, who actually will fight against it. So it's important to actually be vocal in support of it. I would ask you to join the Bike Equity Network. Consider becoming a member of LAB or the Safe Routes to School National Partnership. And when you do that, actually put in your comment area that you're there because you believe and you want to support their equity efforts, initiatives. And lastly, to attend at least these or these couple of conferences, the LAB Bike Summit, I can tell you that the Equity Advisory Task Force will be there at the Bike Summit in 2014, March in DC. I don't know the date of the Safe Routes to School National Partnership Conference in 2014, but I'm pretty confident they're going to have that. So I say look at their website for that. And then lastly, here is the information about resources and contact, how to get a hold of me, how to get a hold of Adonia, and how to get a hold of Keith Benjamin from the Safe Process Food National Partnership. And that's all I have for now. James, want to take it from here?
Great, thank you, Keith. And now we have some time for questions. If you have not done so already, please enter your questions into the question box. But I will start with some of the questions that have already been asked. The first question is for Dana. In your North Carolina study, did the community have a bike shop, be it nonprofit or profit, and was that need identified?
Because this was a pedestrian plan, certainly cycling came up. You know, when you're talking about walking, bicycling and walking go hand in hand, so that need was not specifically identified. However, I mean, you could see in the analysis related to food access and active recreation that some of those distances, you know, a mile is much more doable on a bike than it is walking. So I believe, I don't know, but could find out, I believe that they will be looking at kind of the connection between the bicycle and pedestrian networks further.
Okay, great. What kind of performance measures do you use to gauge the movement toward transportation equity?
This is for me again, I assume?
For whomever wants to answer.
Keith, I'd be interested to hear what the league is thinking about in terms of benchmarks and kind of moving us forward as a group towards equity. Has that been discussed at all as part of the council?
You're right. That is something that's going to be addressed. We haven't addressed or have an answer for it now. However, I was really intrigued by those initial analysis from both you ladies' presentations. So that would be something that's going to be addressed probably with or without your presentations this in 2014. We spent basically like the first year sort of really establishing the whole thing about equity, and so that's one of the things we'll be thinking about as evaluation, especially as it relates to the Bike Friendly America program.
I think, you know, one way that we as practitioners look to whether or not we're making changes is if you think back to that example in the Seattle presentation showing low service provision and those areas really overlapping with at-risk or vulnerable populations, that over time we'd like to see that not be the case. I think that Seattle is not unique in that situation, that typically if you look at where there are good bicycle and pedestrian facilities in a community, this isn't true everywhere, but it's true 90% of the time, you'll also find that the places without those facilities tend to be low-income communities of color, places with underserved populations for a lot of different services also have limited options for transportation. So in terms of performance over time, I would really like to see that change and have us not see that trend across the U.S.
All right, great. Where can one find federal guidelines on transportation equity? Or are there any?
There are definitely, this is Tab, there are definitely federal mandates that relate to transportation equity. You can find them through the US DOT or FHWA websites, but they don't really pertain to pedestrian and bicycle equity. As far as I am aware, there aren't any federal mandates or guidelines that actually specifically reference pedestrian and bicycle equity.
Okay. With regard to access and barriers, how much of a factor should planning be included in that in terms of suburbs or neighborhoods where you have roads that have dead end or cul-de-sacs that don't connect? How much of a factor is that in determining equity and access?
I'm not sure I understand the question. Are you, do you think you're referring to kind of like geographic equity? So the connectivity of the street network is
the connectivity of the street network, correct.
Yeah.
How much is that a factor in improving equity?
I think it's really context dependent. It depends on the populations that are involved and the land use patterns in addition to the street connectivity. I mean, there's no silver bullet saying, if you make every street connect to every other street or, avoid having stub outs and dead ends, you're going to solve the problem. I don't think that's going to get us any closer, but in concert with distribution of destinations and distribution of facilities, I think connectivity can play a big role in addressing some of these disparities.
Okay. If you could offer the nation 3 key actions that could reduce disparities or ensure health equity with respect to walking specifically, what would those 3 actions be?
I would say
you jump in on this one.
Yeah, I would say the first is kind of what I said in my presentation. Understand where the most need is, and there is a lot of research out there that really shows that underserved populations are have greatest need and also particularly youth and access to schools. So as a first action, make sure in every community that you know where those at-risk populations are. And I think Tab touched on this in the beginning as well. Advocate for equity in funding for bicycling and pedestrian projects, but also for how they're implemented.
I want to second what. Go ahead, Dana.
No, go ahead.
I just wanted to second what you were saying about information, understanding where the need is, and that information we can really only get through outreach, through talking to people and understanding who's not able to travel in the way that they need to get their basic needs met. Travel surveys really don't get at it because they don't get at the whole idea of foregone travel or suppressed demand. It really takes much more intensive kind of outreach to understand where the needs are.
I would also add for the bicycling movement, understanding some of the barriers, particularly for communities of color. We've had a number of projects where bicycle infrastructure improvements are very much associated with gentrification and changing neighborhoods. And so one of the actions I would think is to be able to look at bicycling and walking in the larger picture of land use and thinking about the equity implications for populations that are in neighborhoods that are changing and that want improved bicycle and pedestrian infrastructure.
Hey, James,
Yeah.
Can I jump in here?
Go right ahead.
So ladies, and these are some great questions that people are bringing up, and I feel bad that we don't have, just like a bullet point great answers for them. But it really comes back to what I want to ask you folks, is that do you feel that there's even scant enough research to support, like even things around evaluation or the barriers or to bicycling or pedestrian? I mean, as it relates to, the definition of underserved communities.
Okay. Along a similar vein, once equitable projects are built, the biggest engagement problem becomes access to bicycles. Bike share is often difficult to deliver in lower density areas. What can the movement do to increase access to bicycles?
That's a big question.
Want me to take this one?
Yeah, go ahead, Keith.
So yeah, this is one of those questions that is sort of like that underlying one that we really don't address. And a lot of times it really is access to bikes itself and or the supportive services that would come with like a bike shop, like down to the basic thing of a bicycle pump in a neighborhood. So ways to increase that is, through those, either a for-profit bike shop, which is really challenging, or the community bike shop, the nonprofit. One quick and easy thing, I mean, most communities that are underserved, there is usually some bikes. It's just the quality of bikes. But just as a way to start off, there's one idea that's been tried here in Milwaukee. Basically is this, bike shop in the closet. So if a community bike shop, a neighborhood, community center that's already connecting to youth and some adults in the neighborhood, they have like a closet that a volunteer who just knows how to fix a bike, pump up some tires, fix flats, tighten some things up, loop some chain, put that, and have a stand. Post things for about on a Thursday for 2 hours, and then advertise in the community. Probably going to have a line of kids, getting there, putting, at least they know at least once a week they'll be able to put some air in the tires, fix a flat, things like that. Take a lot of pictures, write some names down, and then you can start your way down the path of people are going to want more. And then you can actually start to address the idea of some sort of community bike shop and working with, here's a strange idea, the community block grants as funding for growing something like that. I hope that at least starts to answer that question, because it really is a hard, complicated question.
Yeah, here in Portland, we have the Community Cycling Center. I don't know if many of you are familiar with the Community Cycling Center. And they have a number of programs really aimed at getting bicycles into the hands of both adults and kids that cannot otherwise afford to get them. But I kind of also want to reiterate what Keith said, that it's not just about getting the bicycle, but being able to maintain it over time. So here at the Community Cycling Center, there is a holiday bike drive where kids are given refurbished bikes. And there is also a both adult and kid earn a bike programs where folks can come and put some hours in learning how to maintain a bike. And then at the end of that process, they have a bike that they can ride away that they now know how to maintain and use safely on the street. So I think that there are advocacy programs in communities where we can start to get bikes in the hands of folks who maybe can't afford them, but also just across the board helping to support folks in maintaining the bikes that they have.
All right. We're running short time. I think we got to fit in a couple more questions. Without any direct federal mandate on transportation equity, how can you justify spending the time, effort, and money on equity projects other than just saying it's a good thing or the right thing to do?
How can you not justify, I'm sorry, spending money on equity projects? I would say that there's a lot of evidence, and we see just in practice that focusing on equity from the beginning leads to a more robust planning process and a better plan that serves everyone in the community better. And maybe there isn't, academic research that shows that specifically, but I think you can, particularly when it comes to increasing travel options, you can make the case that improving those networks throughout the city, even if it's in a underserved community, that it's benefiting everybody. It helps the economy, it helps access, it's supporting health, and from my perspective, we we can't really ignore the benefits of helping everyone in a community live a healthy and active life. Anyone else want to chime in on that?
Yeah, I will. It's pretty much understood we have a huge obesity problem, kids and adults. We pretty much understand the barriers that people aren't walking as much, and it's hard when traffic is so fast. So if you want to try and bring down health costs, because those costs are not going away, we know it's going to get worse. This is one element of it, of helping folks to have realistic opportunities to bike and walk. Will, in the long run, help bring down the cost of health costs, healthcare costs, and more of a prevention thing. So the ability to keep money in people's pockets too. That is part of that justification. Is there enough research and supportive and policies that are more connecting those things? Not today, but it is far better. It is far closer to that happening than it has been in a long time.
Yeah, I want to second that there's the research. We need a lot more research on that area, and it's starting to trickle in. And it's kind of low-hanging fruit in the realm of research. I mean, we're getting enough data now, or starting to get enough data where we can actually do some analyses to see what the economic development impacts of reduced access to disparities are, and the obesity impacts. So we're moving in that direction. I think, in a couple of years we'll be able to show some empirical evidence of the more widespread benefits of reducing ped-bike access disparities.
All right, I think we can get one more question in real quick. What is the role, if any, of health impact assessments in reducing these transportation equity disparities?
Want me to take it, ladies? I think it's you guys are probably better at this, but I'm opinionated. I can toss my 2 cents in.
Well, I can have it.
So, basically, the health impact assessments are great for new projects. I think that was spoke about. I can't remember which lady said it. She'll probably speak up after I finish. But they're great for new projects. It's really hard for things that are already have been in place. I think there probably needs to be some another level or health impact assessments 2.0 that helps address some of these existing entrenched barriers to biking and walking.
Yeah, I want to second that it's a good way to get information about new projects, but it doesn't really address existing conditions. And like I kind of mentioned earlier, there's some information that we need to get from people that are actually affected by these disparities that really aren't. The information is really not easy to quantify. So we need tools. We need to develop tools that can help us collect this more context-dependent, qualitative information about ped-bike inequities.
Okay. Well, unfortunately, that's all the time we have today for discussion. I am sorry if we did not get to your question today. If you'd like to learn more about equity in transportation, the Association of Pedestrian and Bicycle Planners will hold a webinar titled Integrating Equity in Bicycle and Pedestrian Planning on December 18th. You can learn more about that webinar at apbp.org. That's apbp.org. Also, the Centers for Disease Control and Prevention just released a new guide titled A Practitioner's Guide for Advancing Health Equity. It is available online at cdc.gov. Once again, a PDF copy of this presentation slides will be available later this week at walkinginfo.org/webinars. And a recording of today's program will be posted to that site as well as to our YouTube channel, which is youtube.com/pedbikeinfo, within a couple of weeks. Be sure to follow us on Facebook at facebook.com/pedbike for updates. And also keep an eye on your email inbox for that email from the Highway Safety Research Center with a link to your certificate of attendance, as this webinar was approved for 1.5 CM credits from the AICP. Finally, I want to remind you that a very brief survey will appear once the webinar has ended. Again, we would very much appreciate you taking a moment to complete it. Thank you again to our speakers, Tab Combs, Dana Dickman, and Keith Holt. And thank you to all of you for attending today's PBIC Livable Communities webinar.